This is another Ask Dr. Safi video. If you have kids, you know that they can be big blessings in your life, but also at the same time, they can be huge sources of anxiety and worry and concern. A lot of times kids can do odd things, fluttering their eyes, moving their arms in an odd way, moving their mouth, jerking their legs in the middle of the night that really make you worried and concerned. And so you bring up these concerns to a pediatrician, and they might bring up the question of, is what your child doing a seizure? Or is it something else? So let me go into a little bit of detail about what is a seizure. See, a seizure is a abnormal occurrence or event that's actually happening within the brain, and it manifests itself in the body. So you might have the classic Hollywood arms and legs jerking, but if it's not actually an abnormal occurrence in the brain, then it's not a seizure. And at the same time, if you have a child that is just kind of arms and legs very still, not moving, and you just see maybe a slight eye twitch and they're staring off, but there's no limb movement, that can indeed be a seizure if it's an abnormality in the brain. So the way I like to define a seizure is it's an abnormal electrical firing within the brain cortical neurons. And I say electrical firing because it is indeed firing of neurons, and you have electricity, electrical discharges, voltages in the neurons of the brain that's very similar to our electronic devices like computers and TVs and phones, etc. And so if you have an abnormal electrical firing of the brain, it is a seizure. And so how does that manifest itself? Well, it depends on where in the brain you're having the abnormal electrical firing. So if you have a abnormality, a seizure occurring in the frontal portion of the brain, then you can have movement of the eyes, you can have movement of the arm, you can have a jerking of the leg. If it's occurring in the temporal portion, you can have an odd sound that your child is hearing, a sickness to the stomach. If it's in the parietal portion, then you can have an odd sensation, a numbness or tingling, a paresthesia. If it's in the occipital portion, then you can have a visual hallucination, spots in your vision or colors in your vision. If it's occurring in the whole brain at once, you can have full body jerking or just an absence or alteration of awareness or consciousness. So it really depends on where in the brain that the seizure is occurring. So how do I figure out, as a neurologist, as a specialist in brain disorders, if this episode that your child is having is indeed a seizure? So I look at a few things. I always ask the family to take an accurate description of the event. What was the child doing prior to the event? Were they tired? Had they just eaten? Were they particularly sleepy? Were they asleep at the event? Was it occurring in the middle of the night? And then as the episode, the odd episode started, how long did it last for? What were their eyes doing? What were their legs doing? And timing the event itself. Then after the event occurred, were they particularly tired? Did they urinate on themselves? Did they fall asleep? Were they very alert and giggly or in a different mood entirely? So one of the beauties of modern technology is we carry smartphones or video recording devices around with us all the time. So I always recommend that families take a video of their child when they're doing that odd event and show it to a neurologist. So I would have the family bring in an accurate description, preferably a video with that description of their child doing the episode and event, and then clinically examining them using my expertise to see how that child is moving and responding. And at the same time, I might use other tools such as an EEG, which I might explain in another video. And putting those three things together is really what I use to determine if a child is indeed having seizures or is predisposed to having seizures, etc. And so I hope this video really helps you to understand a little bit how I as a neurologist think about seizures. And I hope really this can help you to have better discussions with your neurologist, with your pediatrician, with your family practitioner in understanding seizures. And if you know anybody that is having seizures or suspicious of having seizures, then definitely forward and share this video to help better understand the what's happening in the brain during those particular points in time. And I really appreciate you taking the time to watch this video and hope to see you again in another Ask Dr. Safi video.